Good evening, everyone. Welcome to our healthcare ecosystem presentation about partnering for a healthier community. My name is Tim Hernandez. I'm helping to moderate tonight's event. I'm part of the Marketing and Communications Department here at Henry Ford Allegiance Health. I want to start off saying thank you. Tonight's live stream is sponsored by the Henry Ford Patient and Family Advisory Council. It's a group of community advisors. They're always looking for new members, of course. So if you would like to lend your voice, you can reach out to them. Again, this is the Patient and Family Advisory Council. You can just call that phone number on the screen there. A little bit of a housekeeping before we get into our presentation tonight. If you have questions, we do encourage them. You can just add those questions in the comment section here on Facebook of the live stream. So we'll be collecting those questions. If they come to you during the presentation anytime, just go ahead again, comment, and we'll collect all those questions. We'll have some time at the end of the presentation and potentially during our conversation with our two guests tonight to get those questions answered. And with that, I will introduce our two guests tonight. Our first guest, Tashia Carter, is a community project coordinator for Henry Ford Allegiance Health and also the co-founder of Residents in Action. Good evening, Tashia.
Good evening.
Residents in Action is their mission is to build capacity in order to actively influence systems change and help to promote an equitable community. Thus, through advocacy and implementation of actionable community-driven strategies that are led by residents. And our next guest as well is Dr. Courtland Keteyian. He is the Vice President for Population Health for Henry Ford Allegiance Health, and the president and CEO of Jackson Health Network. And you may have seen Dr. Keteyian. He's been on television quite a bit talking to reporters for the coverage of COVID-19 and the pandemic as it's been going on and how our health system has been dealing with those situations. Good evening, Dr. Keteyian.
Good evening. Good to be here.
So like we mentioned tonight, we're going to kind of talk about the health of our community. Also, the impact that COVID has had on Jackson and our surrounding communities, and then also how we can respond to those through community partnerships, because they are vital to our healthcare ecosystem as a whole. And kind of talking about the health of our community here in 2021, obviously there's a lot of challenges, but I think there's a lot of different aspects that make up the health of our community, and there's a lot of different pieces, not just that one health piece. And Dr. Keteyian, I was hoping you could kind of start off there and kind of talk about those different pieces that lead to the health of our community.
Yeah, absolutely. And hopefully folks can see the slides here. There's a few that I wanted to be able just to present. And it's really just to kind of set the stage for the conversation. And so when we talk about the community, we talk about health. We understand that health is not simply determined by what happens within the four walls of our hospital, right? Of our healthcare facilities, our clinics. There's social determinants, is what we call them, but our community, features of our community that drive health outcomes. So in Jackson, we live in a community that is relatively segregated in terms of how we compare across data that come from our community health needs assessment that happened in 2018. We're in the midst of doing another one. It happens every 3 years. And from an income inequality standpoint, also have some disparity there as well. So more so than the average community here in the country. And that disparity is really goes not just to certain segments, but kind of across the population. So the white children, for instance, from a standpoint in terms of financial stability in their household, much more secure, whereas African American children see much higher levels of poverty. So we see that within this community, within the county, we've got both some economic differences and then some inequality in terms of looking at children within the community as well. So what affects children obviously is reflective of the families they live in. And the annual income here So keep in mind the federal poverty level for a family of four is about $12,500, $13,000. So we're above that, but not significantly really here in this community. And you can see just comparing white versus African American, much higher percentage of the African American community is in that poverty threshold area. So again, just some disparity here locally in terms of how we think about economic differences. It's also kind of useful, I think, to compare, again, community-wise, the city versus the county. So it's a little bit of a zebraed place, so to speak. So we've got a much lower proportion of white folks living within the city of Jackson and a higher percentage of African American. So just demographically speaking, the city is much more diverse than the rest of the surrounding county. And so that just plays into those differences demographically that we have here locally. And these were actually survey questions that are asked of folks in the community. So there's actually high percentages of people that have some insecurity or don't have sense of belonging. We have a lot of ER use that is not really for conditions that one would say are appropriate for ER utilization. Almost a third, actually. So that's really significant. And so that has impacts on the community and our ability to deliver care when we have that much care happening in the ER that's really not best cared for in that environment. We have issues in terms of getting people fresh fruits and vegetables, which we know is really highly correlated with people's overall health. And then I think staggering that people don't use opportunities to exercise here. So we have some habits in terms of exercise, healthy eating that could certainly be improved here locally. Talk a little bit more about that family perspective. And employment is obviously a really important part of economic security and financial stability. And these numbers are a little older now, dating back a few years, but you can see the disparity or the discrepancy, which I think is important to point out. So we know that white folks have a little bit easier time with employment here locally. Overall, the unemployment rate, nearly 9% at the time, is quite high. We've actually seen this trend down recently as we've really seen the economy start to pick up, but there is still some disparity here locally in this dimension. One of the things that people struggle with from a employment standpoint is actually mobility. And so having not only access to jobs, but access to transportation to get to jobs. And we are a community that is very dependent on cars for our transportation. So if people don't have a car, it's pretty hard to get to work. And so that you can see here basically is rather low walkability score, and the almost a third of folks who live in a renter environment that don't have access to a car. So hard to get a job, hard to have reliable work if you don't have a car to access that job. And we don't really have other public transportation options for people. So things we have to think about when we're thinking about community health and an ability for people to have employment. And this plays out in some ways that we talk about from a health standpoint. So infant mortality is kind of a key health indicator. And so you can see here the disparity, but also the rates of infant mortality in white babies versus black babies, and the rate in that African American community much higher. We've actually made really significant gains over a period of time on that infant mortality rate, but we've seen it creep up in the past few years. So work there still to do, but again, just kind of highlighting the disparity. Much of it is driven by prenatal care, and so on the side of the slide, you can see the sort of the meter that shows prenatal care differences. So white women more likely to get prenatal care, and that certainly has an influence on that infant mortality rate after children are born. Just a few more kind of stats here I think are really interesting. So we talk about prenatal and infant mortality. Also can talk about opioid use, which is really kind of a national crisis. This has been overshadowed within the last year or two with the COVID pandemic happening, but the opioid pandemic also is really a crisis, and I think it's really staggering. 2017 alone, 12 million doses of opioids prescribed in a county with 160,000 people, which is incredible. So that's 80 doses per person. And think about how many of us, don't take opioids at all, and so how many of this is really being prescribed to select groups of people. So this is a huge problem locally, and then you can also see kind of shifting gears a little bit to abuse and neglect victims. We are well above average in children. So again, just kind of painting the picture, and we're going to talk about both the community, but also some impact of the current COVID environment we're talking about. But a community that does less well from an economic standpoint in terms of resources. Unemployment tends to be higher, and then challenges within for mortality, opioid use, and here you can see abuse and neglect numbers. So definitely some opportunities for us here from a health standpoint, and these are factors affecting folks outside of the hospital, right? When they're in the community. And then just a few comments on children. Higher rates of poverty in families. Almost a third of youth live in families with poverty. Creates tremendous barriers for children as they grow up. And in single-family households, that rate of poverty is staggering at 60%. So tremendous challenges to be able to be successful in environments like that. And so when you think about that, you think about how do people sort of get ahead going forward. And this is an expected earning graph when you look at how people do based on level of income. So we would expect that as folks attain higher levels of income, they're going to make more money, be more financially secure. That's exactly what this shows. And then if we actually overlay that or apply that here locally in the county and look at the percent of people with higher education, very low rates of overall higher level attainment of education. A whole population, just about 20%. And you can see some disparities there as well between black and white. So really, education often is a key driver of health outcomes. And we see that people that have more education attainment are much better able to manage their health conditions. So this is again how a social factor can contribute to somebody's health outcomes and what we deal with when we see patients in clinic in front of us.
Outside factors for healthcare, that kind of affect getting to appointments, having employment, having insurance, and those things, Dr. Keteyian. And I think the past couple of years have been obviously outliers with the pandemic. How is that? I mean, those issues are kind of already in place. I'm assuming COVID has kind of exacerbated a lot of those issues. And just how's COVID-19 and the pandemic kind of affected our community?
Yeah, COVID is definitely basically we had a pandemic overlaid on top of these challenges we're already facing as a community. So certainly didn't make it easier, and it was more for us to deal with when the pandemic hit. And we have some data that we can share just reflecting COVID locally, and the health department is a great resource here locally. And so this is the county health department, Jackson County Health Department. And this slide is showing us the number of cases that we've had here since the pandemic began. Over 20,000 cases. This is almost certainly a really significant underestimate of the cases happening because everybody doesn't always get tested, right? So somebody might have some symptoms. They might have that fever or cough, shortness of breath, lose their taste or smell, and not realize it's COVID and never tested, right? So this is really an underestimate, but already a significant amount of the county has had cases, confirmed cases. And right now, you can see kind of these three peaks in that COVID curve. That's called the epi curve. And so we're in this pretty significant, it's actually a fourth wave. If you look all the way back to the very left-hand side at the beginning, we had very little wave at all at the very beginning, right when COVID really kind of first started back in early 2020. And we've had two more significant peaks since then, and now we're into our fourth. And I think that obviously the deaths are horrible, but if you look at the active cases, count here, having over 2,000 active cases at a time is really quite significant. We haven't been in this situation since really back in the middle of the third wave, which was the April-May timeframe. So we are nowhere close to through with COVID at this point. We're still in one of the worst periods we've had from a pure case count standpoint. So we really need to continue to have folks be vigilant and doing the things we've talked about: hand washing, mask wearing, and getting vaccinated, which is the most important.
Yeah, and I know you mentioned, there's cases people haven't always gotten tested, they've gotten sick, they've had symptoms, but maybe these numbers are low. Is that kind of where that probable figure comes in? I know there's that orange peak.
Exactly right. Yeah, and I can go back and show that, and that's a good question, Tim. So there's a difference on the graph between, basically there's a blue bar and then an orange bar, and it's been the blue bar for a really long time, which is the only thing that's been included on the curve. The orange bar was added just a few weeks ago, and that's called probable cases. And the way you get a probable case is the health department does an investigation of a case, because all these are reported to the health department, and they talk to maybe the members of the family or the folks in the school or the place where the outbreak happened, and say, well, so-and-so got symptoms too, but didn't get tested. And they happen to live in the same household and got those symptoms at the exact same time as the case that we knew about. So that's really a probable case. And so it's when something's deemed probable, that means that we call it an epidemiological link to the original case. So in this case, probable it's very likely that was a COVID case. And we count those as COVID because we've done that case investigation that gave us that information.
Okay, so it's not just some kind of data, just extrapolation, just kind of guessing in numbers. There's been an investigation and people following it.
Right. Yeah, the health department's investigated that.
Okay, thank you.
Sure. So there's a few other points here probably worth making. The case rates, and want to highlight a few kind of statistics here. So you can see the cases by age group on the left side, cases by sex in the middle, and then cases by race on the right-hand side. And so the top of the slide is really the total numbers. So high case counts in those kind of middle age populations, and obviously Jackson County being a county that's predominantly white, we have more cases than white people. But then if you look at the case rates, so now you start to normalize based on how many people there are. So when you do that, you can start to see case rates really high in teenagers and 20-year-olds. That really has driven a lot of the cases more recently. We've seen data just in the last month or two, particularly in that under 17 population, 17 and under population, where we've had really the most growth in cases here locally. And then cases by race, you can actually see that from a cases per million standpoint, that the white population, Caucasian population here, has had more cases on a population basis than the African American or Asian populations. So we've actually seen more cases per million or per thousand in that population. And those are cases. People always ask about hospitalizations. So when we have hospitalizations, we track those within the Henry Ford Health System. And we've got here, you can see right now currently in the system, almost 200 folks are in the hospital. Locally at Allegiance, there's somewhere usually between 30 and 40. That's been the case for the last few weeks. And you can see here is those red folks are fully vaccinated and the blue figures are the unvaccinated. So this is disproportionately a problem for unvaccinated people, especially people that are the sickest of the sick, the ones that are in the ICU and are ventilated. The other thing to keep in mind here too is that people who are being hospitalized, even the vaccinated ones, the people who are vaccinated and hospitalized tend to be people with pretty compromised immune systems. So these are the people who think about your cancer patients or transplant patients, things like that. So their immune system just couldn't really mount a vigorous response to a vaccine. and didn't really have the protection they needed, which is exactly why it is so important for everybody else to get vaccinated, because there are certain people in the population that we need to watch out for that simply cannot mount a good, strong immune response. And so that's really why that herd immunity you might hear talked about is really, really critical.
And I think these case numbers that you shared, these are the latest ones, but these have just continued to rise this fall, correct? The numbers that we're seeing, and some of the breakthrough as well is continuing to rise just because of rising cases.
Yeah, that's absolutely right. And we've definitely seen, and there's a few different reasons for that. We showed the slide with the different components of it, epi curve, and how this fourth wave has been really significant. But the Delta variant, which is the dominant strain now. So if you think back, it's been basically 2 years we've been doing this at this point. There was called the wild type, and there's been these different variants that have developed. There's been a UK variant and South African variant and Brazilian variant, and now we're on the Delta variant, which originated in India. And the Delta variant is basically the most communicable, so the easiest to spread between people. And so we're seeing more of these, quote, breakthrough infections in vaccinated people who have been getting Delta variant. And so it's not that the vaccines are waning as much as that the virus that we're combating has evolved. It's different, and it's easier to transmit. So again, this is why it's so important to get vaccinated. That's how we keep people out of the hospital that don't need to be. And that actually wears, I think, on a lot of the staff, because you see people in the house that are they don't need to be there. Right? These are preventable illnesses, preventable hospitalizations, and so it's really difficult to just sort of watch the suffering that happens in the hospital that just doesn't need to be there. So that's a great question. I was going to speak a little more just to the disparities, because we kind of framed that from the beginning, and talked about what our community looks like, and there's disparities that happen in other contexts, whether it's financial, otherwise social, or economic. And this is a graph that is borrowed from it's national data, but you can see it's very current, and there's discrepancies nationally between different populations in terms of Asian Americans, white Hispanics, and Blacks, what the percentage that's been getting vaccinated. And you can see certain communities just lagging overall in terms of getting their full, or this is one dose, but it makes the point that there's differences demographically. Now, if we look locally, this is within the state of Michigan, and you can see that the white population compared to Black population, those same discrepancies. Actually, Hispanic and Asian populations have actually been vaccinated at higher rates. So this just shows here locally how we have some of that same dynamic that we see play out nationally, and an opportunity for us to be able to still close those gaps here locally in our population. And there's still some hesitancy in terms of getting vaccinated. Zooming out, people talked about early on the kind of 70% target. So we're at about almost 70% at this point. So we've been getting there. In a little bit lower range than that, and so still opportunity here for us to be successful vaccinating people. And here you can really see that top line graph is where we've kind of flattened out, and we're at about 60% here locally in Jackson County. So still some opportunity for improvement, And you can also see age-wise, which I think is nice. We've done a really good job here locally, making sure that the older population that is most susceptible to the ill effects of COVID-19, getting them vaccinated, and now working on getting them boosters as well. So this has been really, I think, a good effort, but still lots of opportunity to get people vaccinated here locally. So as we're talking about vaccines, I thought it'd be nice to give a few updates on vaccination. And there's always updates on vaccination. This changes every day. But today, just a couple reminders, just the three primary modes of people getting vaccinated. So the Pfizer, the Moderna, and the Johnson & Johnson vaccines. One of them, the Pfizer, has full FDA approval. Both the Johnson & Johnson and Moderna vaccines are under review currently to receive that. And the Pfizer vaccine has what's called the emergency use authorization to start in 12-year-olds. So there are vaccines available now for 12 and up, and with the Pfizer vaccine being the one that's fully approved. The booster is really the thing that's been the most recent news. And so if you were to get, you can see here vaccine by vaccine, but the Pfizer vaccine happens 3 weeks apart, Moderna's 4 weeks apart, and then Johnson & Johnson is just a single dose vaccine. The booster for those mRNA vaccines, the Pfizer and Moderna, should happen 6 months after the first dose, or the second dose rather. And then for Johnson & Johnson, it can be as early as 2 months later. And it's only specific populations where that's the case, and these recommendations are the same no matter what the vaccine is. It's focused on the vaccine in the more senior population, so 65 and older, people that have housing in long-term or group housing type facilities, long-term care settings, people that have underlying medical conditions that put them at very high risk of a bad outcome. So think about those patients I talked about before, folks that might be on chemotherapy or have immunocompromised because they had an organ transplant or take a medication that suppresses their immune system, diabetic patients, people that have immunocompromised. And the last is folks with occupational exposure. So people working at the hospital that come into COVID contact more frequently also are recommended to get vaccinated with a booster. And those are available now. We're doing that for our staff and making that available for patients that need that through our various clinic settings.
So we still need to be vigilant. We still need to get people vaccinated. You kind of address some of the disparities that we're still seeing. Obviously there's the national disparities, and locally we're seeing some of those. How are we kind of working, or how have we worked to try to address some of those disparities, at least with getting COVID vaccines and some of those pieces for our community?
Yeah, and we've had to do that very deliberately. And COVID vaccines, getting it to parts of the population that needed it more, or had have difficulty obtaining it, was something we really tried to do very deliberately. So since the beginning, we've vaccinated over 55,000 doses, and have done a few things very specifically. So really early on in the game, we partnered with the school district to get vaccines out to all the educators. We were the first county in the state to basically make a vaccine available to any educator that wanted it. And we're actually partnering with them again right now to get booster doses out to the teachers. So really important to keep kids in school, and we were happy to be a partner with that. And then the King Center, the city has been a wonderful partner, and we delivered over 1,000 doses at the King Center, understanding that there are folks with transportation challenges and wanted to make sure that we got vaccine to a place that was accessible to public transit and also in a part of the community that needed that access. So I'm very pleased we were able to do that and partner with the city on that piece. I want to take a minute and I'm going to hand off to Tasha here soon, but really to talk about there's a framework and a foundation we have here to help support social needs at all times, and we kind of flexed this infrastructure to deal with the COVID pandemic. It's called the Jackson Collaborative Network, and the hospital's a part of it. But we have partners that are across the community. These are agencies that do things that help support social determinants, and there's a collaborative council. So there's a group that kind of meets together to help think about how we can plan and strategize to address these opportunities. And the three kind of key pillars are the health improvement organization, which is really led by the hospital, but then also education and financial stability are the two other key elements of the network. And the collaborative council is something that people can Google and learn more about it and see all the organizations that are part of the collaborative network. And that's from the hospital to the health department to United Way. It's many entities, over 50 entities here in Jackson that participate in the collaborative network and its work. One of the key things that the council really developed in the last few years was the Care Hub. And so what the Care Hub it's a tool, it's a platform that allows closed loop social service need referrals to be met. So in a care environment or other environments with community partners, we can screen patients for social needs, place a referral, hook up a patient with a care navigator, and get that need met, make that connection. And so the way that really played out with COVID is we had patients that might be deferring routine care, and so we know that we had screening rates decreasing in a clinical setting because we just didn't have those clinical settings. Patients were coming to the doctors frequently, and so partners for the hub did some innovative things. They designed a QR code that could be scanned from websites and flyers to help people get access to screening that way. Also, a social needs tool. So whenever a patient tested positive for COVID, our screening nurses would go through that tool with the patient and help identify if they had social needs to be met. Actually doing that, we would find things like housing instability, financial needs, and there were instances where we would actually help support and get housing for folks that wouldn't otherwise have been able to have housing when they needed it to be able to isolate from their families, helping keeping their family safe and getting them nice stable housing. Since we implemented this tool, over 5,000 people were screened in the first 3 months. So this happened really early on in the pandemic. So March, April, May, June, and within 3 months we were screening 5,000 people. So really a positive development, and you can't address a need unless you can identify it. So being able to identify and then using this foundation to help bridge that gap and get people the resources they needed. And the collaborative network really does a lot of things. So we, through the course of the pandemic, there was a community-wide what's called an incident command structure. And the incident command helps basically identify where there are needs, and then help organize the work to make sure that we're working together to make sure we're not doubling efforts and really direct resources where needed. Allegiance received FEMA funding, and I talked about helping secure housing for people that had COVID-related challenges. So that was one of the ways that we did that. If people screened positive for housing needs, we would use that FEMA funding to be able to help place folks in housing situations. We worked with the Residents in Action. I'm impartial to girls, and you're going to hear more from Tasha. But to make sure we were getting things to families that needed them. So when store shelves were cleaned out of diapers and formula, we helped purchase those and distribute with our community partners, because the hospital, doesn't make sense for the hospital to go knocking on doors and trying to deliver services. But if we can partner with folks that are integrated in the community, can do that work, that are trusted partners in the community, then that's what we want to do. And we want to collaborate with people locally. So have great community partners that helped us with that. And not just the food, but also other basic needs in terms of just vaccine communication and access. We already talked about the King Center. So really lots of different efforts that we did, but working through our community partners, not as the hospital, but as the collaborative network.
Yeah, and I think meeting some of those needs is, the hospital does healthcare. We do a very good job with the healthcare aspect, but sometimes meeting people in their neighborhoods or where they're at, that's not necessarily our expertise. And I think that's where a lot of times we lean on our partners. And I'd like to bring in Tasha to kind of talk a little bit about what Residents in Actions, how they've helped Henry Ford Legion's Health during the pandemic kind of reach our communities that we can't sometimes reach.
Thank you, Tim. So I appreciate Dr. Keteyian, you pulling in some of the statistics, the local statistics, the disparities, because it is true that COVID exacerbated existing conditions locally in the Jackson area. And with Residents in Action, we're a group of community influencers who mobilized early on in March to address issues related to COVID first and foremost. At the time, it was we wanted to learn about what COVID was, why it was important to understand what it was, what were things that we could do to mitigate the spread, because COVID was really exacerbating, or it was ravaging Black communities in other areas, and we didn't want that to happen in Jackson. So we mobilized, and like I said, we're community influencers committed to addressing concerns that are identified and prioritized by the community. We have served as change agents with lived experience and that trusted person status in the community. We developed a community-based workforce model that has demonstrated results. We've also challenged organizations. We've challenged Henry Ford Allegiance Health. We've challenged other organizations and agencies in the Jackson area to do things differently. And we'll continue to kind of be that driving force to disrupt the status quo that perpetuates inequity. And then we've also built capacity from being within as residents, leading our own change, so that we can hold ourselves accountable, but also have the knowledge and skills and the confidence to challenge organizations and agencies to be accountable as well. So we know that, and with Dr. Keteyian showing some of those disparities, really every aspect of the Black life experience is every category. I don't care if you look at education, the legal system, medical, whatever, every aspect is disparate. And so we challenge leaders to do things differently. And Henry Ford Allegiance did answer some of those costs when we identified early on that the shelves were empty. During that time when we went into the stores and the toilet paper the shelves are empty. You couldn't even buy toilet paper. That same thing was happening with people in the community going in to purchase baby formula. And some of those people were, they had WIC coupons, and the WIC coupons have expiration dates. And so when they went in to get baby formula and there was no baby formula, by the time the shelves were restocked, some of those coupons had expired. So families were left with, how are we going to feed our babies? And so worked with leadership at Henry Ford Allegiance Health, and we were able to develop a process to work through their procurement process to purchase baby formula. Partial to Girls, to this day, they still utilize that service, and they're able to help feed babies and fill that gap. We also, with Henry Ford Allegiance Health, we applied for a grant through the state of Michigan's coronavirus task force. It was focused on COVID disparities in the Black community. As a result of that, we were able to purchase Kinsa thermometers. And so I should have brought one so that you could see it. It's a smart thermometer, and it works like the weather channel. So there's a link that you can go to, and it predicts where there are high rates of infection demographically. And so we were able to get those Kinsa thermometers out into the community so that people could self-monitor themselves at home and work with that app to have an idea of when it was time to go to the hospital to get more assistance. So this slide right here shows that after that project, there was we saw improvement in Black cases per million, and we attribute some of that to the local efforts that Residents in Action and the local partners, Partial Girls and YPAP and other individuals who are part of Residents in Action. So what's on the next slide? Let's see. I will say because of some of that success, we were able to secure some other projects with Henry Ford Allegiance Health. Specifically, we did a vaccine communication campaign where we used strategic framing to tailor messaging for the Black community. And through that process, we interviewed Black residents on, why they were reticent or hesitant, and we were able to develop messaging that resonated more with the Black community. As a result of that, we were able to create a video, an informational video, and we also have flyers that we were able to create. And all of the information that we create, those trusted resources in the community they disseminate that information to friends, family, and loved ones. Also, another project was the vaccine access project that's still going on. And basically it's for those that are ready to get vaccinated. We work with them to overcome any obstacles or barriers that they have. If it's transportation, if it's just someone holding their hand to go actually get the vaccination, if it's help with scheduling, we fill that capacity to help for those that are ready. And then also because of RIA's success, we were able to secure a grant with Michigan Health Endowment Fund, which will focus on food security for Black children locally. So our call to action really is to encourage other organizations and agencies to kind of jump on board to partner with trusted resources in the community, such as the grassroots efforts, such as Residents in Action, to tap into the populations that have historically experienced inequity and directly invest in those types of efforts so that we can continue to reach people in those populations.
Tasha, you mentioned trusted resources. Can you expand on that? Because I think that's an important aspect of some of the work that you do and our partners do, as well as being a trusted resource, because I think that means a lot to the individuals that you're connecting with.
That you cut out, Tim, when you asked the first part of your question.
I'm sorry. Could you kind of expound on what you mean by a trusted resource? I think that's important to a lot of people that you're connecting with. Okay.
So trusted resource is residents in the community, that people who live here in Jackson that are boots on the ground helping people. They like Partial Girls. I'll throw her name out. Selena Taylor, Davita Quinn, Maisha Jones, Keisha Hamilton, Diane Washington, the people who are boots on the ground helping in the community, and they're trusted. So in situations where, because I'm a Henry Ford Allegiance Health employee, I've also connected with some of the other things that Dr. Keteyian referenced, like the Jackson Care Hub and that COVID-19 screening and some of the things that we did to address, because of the executive order, a lot of the help, well, most of the help agencies locally, their doors either closed or access was very limited. So it was important to create other access or touch points, and the residents filled that gap. And the web-based tool with the QR code that Dr. Keteyian mentioned, we were able to disseminate that to people in the community so that they could stay connected. So directly invested in the people, the residents. And we hear that word change agent and authentically engaged, but really residents need to be the ones who lead this change. And if we look at those statistics again and those disparities, we see that what we've done in the past isn't working, hasn't worked. So we need to do things differently. And I truly believe, based on what I saw throughout the pandemic and prior to the pandemic, we need to directly invest in the residents to lead their own change.
So we did get I'll kind of jump into question and answer portion here a little bit, Tasha. But the question is, how can people help? Like, what can they do, like, for Residents in Action? Is it time? Is it money? Is it something else? Where do we start this work, or how do we continue this work?
All of the above. So one of the things that we did, so we started out with this COVID focus, right? And then all of these social injustices occurred in the year of the pandemic, right? And so Residents in Action decided to continue. And we are currently in the process of establishing our legal entity. We will have a LLC for our service line. We do community assessments. We do data collection to get information and feedback from populations that organizations, agencies, and professionals will never tap into because they're not trusted. So we will establish our service line, and then we also will establish a nonprofit. So if you can help us do that, we are currently in that process. You can reach us through the Residents in Action Facebook page, and we are more than willing to accept assistance. I will share one other statistic. Nonprofit Network, they have stated that in Jackson County, there's 40 large nonprofits, and of those 40 large nonprofits, they consider large a nonprofit that has an annual operating budget of 200,000 or more. So of those 40, they consider 3 of those 40 Black-led. And so Residents in Action, were a lot of groups that were already doing really good work, and those groups are doing good work prior to COVID, and then they came together, mobilized a lot of them with Residents in Action. But one of the issues is those groups are not, they don't have a nonprofit status, and funders, because of how policies and processes are, they won't donate money to groups that don't have a nonprofit status. We don't feel, Residents in Action members, we don't feel that we need 100 different nonprofits. We need one solid foundation that can serve as a central hub or an umbrella to help coordinate and organize and mobilize grassroots efforts. And so that is our goal, to become that central hub for smaller grassroots organizations and to support resident-led initiatives and directly invest in residents by funding a community-based workforce to pay people who are doing the work.
Great, thank you. I do want to mention too to our viewers that we do have time for question and answer now. We kind of reached towards the end of our presentation, so if you do have any questions for our guests, feel free to type them in the comments section. I do want to ask kind of a question to both of you outside of responding to COVID, which I feel like we've been doing for the past 2 years now, the health system and then with Residents in Action. I guess outside of that, what other ways are you looking to make an impact? Like with Residents in Action, kind of talked a little bit, to kind of make an impact. Go ahead, you go first.
I'm sorry, I didn't. It was. I didn't hear what he said.
Just outside of response, what else are you looking to tackle?
I'm sorry.
You're fine.
Okay.
I can.
Who was talking?
I was just asking both of you, outside of COVID and our response for the pandemic, we've been doing the past couple of years, what other things are we looking to tackle to kind of check those disparities that we've seen? Dr. Keteyian from the healthcare side, and then Tasha, obviously, with Residents in Action. If you could kind of explain what your group is looking at next.
You want me to go first, Dr. Keteyian, or you?
Go ahead. Yeah, go ahead.
I will just kind of reiterate that direct investment in people. I think that has a multifaceted approach. One, they can be utilized to identify and address root causes. We do too much band-aiding of symptoms, and if those, Keisha Hamilton says this all of the time, those who are closest to the issue or the problem have great ideas, but they don't have the resources to make some of those innovative ideas come to fruition. So by letting people lead their own change and investing in them to do so, you can tap into whatever that root cause is and address it head on. And you're also helping with poverty because, like I said, that community-based workforce, we are paying residents to serve in that capacity. And so you're addressing poverty as well.
Yeah, so the thing I would add to that from a hospital or from a population health perspective is, we really need to double down on the types of things we're doing to engage those community partners. So it's really both. It's something that I think we realize could be a tremendous asset when you're faced with a pandemic like COVID. But all the investments you put in over the years to build a care hub, to develop a collaborative council, we really need to double down on those efforts and continue to focus on root cause analysis and addressing social determinants upstream, so people don't end up in the hospital if they don't need to be. We showed that slide that 30% of ER utilization is for things that they aren't emergencies, right? So we need to get that care out in the community upstream and take care of those problems sooner.
Okay. It looks like we don't have any questions coming in at this point. So I am going to wrap us up a little bit early. I want to thank both of our guests. Dr. Keteyian, thank you for coming on. Tasha, thank you for being a part of this as well. And I also want to thank the hospital's Patient and Family Advisory Council for sponsoring tonight's event. Tons of information. This conversation will continue into the future. I want to share some information for people that, if they want to get involved, a lot of information came from the nonprofit network that Dr. Keteyian shared. Residents in Action, there's the Facebook page Tasha had mentioned. And then again, if you want to be a member of the Patient and Family Advisory Council, there's some information on the screen there as well with a phone number that you can call and kind of contact them and reach out to them and Amy Sales. So again, thank you, Dr. Keteyian. Thank you, Tasha, for being part of tonight's event. And thank you, everyone, for viewing.
Thank you.
Thanks, everyone.